Mucinex Cough is used to relieve coughs caused by the common cold, bronchitis, and other respiratory illnesses. Guaifenesin, one of the active ingredients, works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. Dextromethorphan, another active ingredient, works on the cough center in the brain to reduce the urge to cough. If you are considering using this medication, it is important to carefully read the package instructions to ensure it is right for you. Cough and cold products are not recommended for children younger than 6 years old, and some are not recommended for children younger than 12 years old. It is important to ask your doctor or pharmacist for more details about using the product safely. Mucinex Cough does not cure or shorten the length of the common cold and may cause serious side effects if not used properly. It is important to follow all dosage directions and not use the product to make a child sleepy. It is also important to avoid giving other cough and cold medications that might contain the same or similar ingredients. It is recommended to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or using saline nose drops/spray. When taking Mucinex Cough, it's important to follow the directions given by your doctor or on the product package. Make sure to stay hydrated by drinking plenty of fluids to help break up mucus and clear congestion. The dosage of Mucinex Cough will depend on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take this medication more often than directed. If you're using the liquid form, be sure to measure the dose using a special measuring device/spoon. Avoid using a household spoon as it may not give you the correct dose. For powder packets, empty the entire contents onto your tongue and swallow. If you're taking the capsule form, swallow the capsule whole. It's crucial to use Mucinex Cough as directed to avoid serious harm. Do not increase your dose, take it more often, or use it for a longer time than directed. If your cough returns or is accompanied by symptoms like a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, be sure to contact your doctor. These could be signs of a serious medical problem and you should seek medical help right away. Some possible side effects of using Mucinex Cough include dizziness, drowsiness, nausea, and vomiting. If these effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to note that your doctor has determined that the benefit of using this medication outweighs the potential risk of side effects. Most people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to Mucinex Cough can occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to keep in mind that this is not a complete list of possible side effects, and if you experience any other effects not mentioned, it's important to contact your doctor or pharmacist. As for the optimal timing and dosage, it's best to follow your doctor's instructions. Typically, Mucinex Cough is taken with a full glass of water, and it's important to drink plenty of fluids while using this medication to help loosen mucus. Taking this medication with food may help prevent stomach upset. If you have any concerns or questions about the dosage or timing, be sure to consult your healthcare provider. Before taking Mucinex Cough, make sure to tell your doctor or pharmacist if you have any allergies to Guaifenesin or Dextromethorphan. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, a cough with blood or large amounts of mucus, or liver problems. It's important to note that Mucinex Cough may make you feel dizzy or drowsy. Using alcohol or marijuana can increase these effects, so it's best to avoid them while taking this medication. It's also important to avoid driving or using machinery until you can do so safely. If you're using the liquid form of Mucinex Cough, it's important to be cautious if you have diabetes, liver disease, or any other condition that requires you to avoid sugar or alcohol. You should also consult your doctor or pharmacist if you have phenylketonuria, PKU, or any other condition that requires you to limit your intake of aspartame. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you're using, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant, it's important to discuss the risks and benefits of using Mucinex Cough with your doctor before taking it. And if you're breastfeeding, consult your doctor before using this medication, as it's unknown if Guaifenesin or Dextromethorphan passes into breast milk. When taking Mucinex Cough, it's important to be aware of potential drug interactions. Certain medications, such as MAO inhibitors, can cause serious side effects when combined with Mucinex Cough. It's important to avoid taking MAO inhibitors during treatment with Mucinex Cough, and to consult with your doctor before starting or stopping any medications. Additionally, it's important to be cautious of other products that may interact with Mucinex Cough, such as rolapitant. Always check the labels of your medications to ensure you are not taking multiple products containing Guaifenesin or Dextromethorphan. It's also worth noting that Guaifenesin may interfere with certain lab tests, potentially causing false results. Be sure to inform your lab personnel and doctors that you are using Mucinex Cough. As for the best time to take this medication, it is recommended to follow the dosage instructions provided by your doctor or on the product label. This may vary depending on the specific formulation of Mucinex Cough. If someone has taken too much Mucinex Cough and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. It's important to seek help right away if you or someone you know is experiencing these symptoms after taking Mucinex Cough. If your doctor has prescribed Mucinex Cough for you, it is important not to share it with others. It is also important to keep all of your medical and lab appointments. This will help ensure that you are using the medication properly and that it is working effectively for you. If you forget to take a dose of Mucinex Cough, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Mucinex Cough, it's important to keep it at room temperature and away from light and moisture. It's best not to store it in the bathroom or freeze the liquid forms of this medication. Different brands of Mucinex Cough may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. And as with all medications, it's crucial to keep them out of reach of children and pets. When it comes to disposing of Mucinex Cough, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, it's best to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.